quick review on how we end up with myocardial infarction. So the most common cause of death is in fact myocardial infarction as a result of an atheromatous plaque causing the formation of a thrombus resulting in thrombosis. And so what happens is, usually in a healthy endothelium, we get the endogenous production of nitric oxide, which we know is a vasodilator. And that's very important in allowing, normal blood perfusion. However, when there is some form of endothelial damage, so this could be a result of perhaps prolonged hypertension, type 2 diabetes, or if there's a familial history of ischemic heart disease, all these sorts of things will predispose someone to endothelial damage. So this endothelial damage will cause nitric oxide production dysfunction, and this will result in upregulation of cell adhesion molecules. This allows for the recruitment of monocytes, which of course move into the intima, which is the inner lining of our blood vessels, and this excess LDL that we have, which is the cause of our plaques forming in the first place. So our cholesterol, our excess cholesterol, is being carried by low density lipoproteins. They accumulate into the intima, and this results in the endothelial cells as well as the monocytes, which have moved into the intima of our blood vessels, which produce free radicals, and this actually causes the LDL that's accumulating within our blood vessel to become oxidized. Our macrophages, which have differentiated from monocytes, take up this oxidized LDL and they become foam cells, and they recognize this oxidized LDL by scavenger receptors. So now our macrophages have become foam cells. They release pro-inflammatory cytokines, and this allows ultimately to form our fatty streaks. And along with the pro-inflammatory cytokines, we have growth factors. This is going to allow smooth muscle proliferation and migration around the lipid core. We get our dense fibrous cap with hard calcified regions, and as we continue to produce these cytokines, macrophages will ultimately be the cause of rupture. This is going to expose things like collagen, which is inside of our fibrous cap, and this will allow for activation of platelets, and we will get the formation of a thrombus, ultimately leading to occlusion of the artery, and if this is one of the coronary arteries, we of course end up with myocardial infarction.